All right, well, hello everyone. I'm Yvette Berry. I'm the ACT Education Minister, and with me is Dr. Vanessa Johnston.
Hello.
Hello, who is the Deputy Chief Health Officer here in the ACT. And we're here to talk with you because we know that people are a bit concerned about what's been happening with the pandemic, and we want to provide some reassurance for everybody around a return to school with some really good health advice and also some of the things that we're doing in our schools to make sure our school communities are safe. So we've had a lot of questions from a lot of people, and so we're going to start with asking those questions now of Vanessa. So one of our first questions, Vanessa, and this is something that you're very much across, a lot of parents have been asking about the health guidelines for schools. So can you tell us about those main features?
So as you know, the health guidelines are available on the Education Directorate website. And really there are a series of measures for schools and parents to understand what the health advice is in regards to schools going back and the kind of preventative measures that they can take to protect children as we slowly ease out of lockdown and return to school. So they contain things like some of the things we're very familiar with already. Don't go to school if you're unwell. And now more than ever, that's important because we know we have transmission of this virus now in our community. So if you have a sniffle or a sore throat, a runny nose, whether you're a staff member, someone in the administration area, a teacher, a child, you should not be going to school. You should be going to get tested for COVID and staying at home until you get a negative test result. The other things that we're very familiar with, the tried and true COVID safe behaviours. So physical distancing where that's possible, really good hand and respiratory hygiene. This time around, going back to school, there's the issue of mask wearing, of course, which we are mandating for all teachers, all adults on site, and also for everyone in years 7 to 12. And in the primary school, for those aged or in years 3 and 6 to 6, it's really at the discretion and guidance of the child and their parent, whether or not they'd like to wear that mask. For the P to 2 classes, we're recommending that they not be used because we know they're not really used according to best guidelines by the little ones, and they can actually be a choking hazard for the really young ones. So there's the advice around masks. Cleaning is really important. Obviously we know the Education Directorate is really stepping up in their cleaning regimen, cleaning of high touch points, the bathroom facilities and the classrooms. Ventilation's important, so we've heard a lot about ventilation, just the importance of ensuring that outside air can come into the classroom. And that can be as easy as opening some windows or doors, or on those days that are too hot or too cold, making sure that the heating and the air conditioning unit isn't recirculating internal air and it's allowing that outside air to be circulated in. Some of the other measures that we're recommending is a staged return of students. So year 12s are already back and the other classes are to follow as laid out in our ACT pathway going forward. And that's really to reduce at the very outset the number of people on campus at any one time. And other measures to reduce mixing and mingling in there are things like having staged times for recess, lunch break across the years, making sure that there aren't large gatherings in internal spaces like assembly halls and the like, making sure that those sort of gatherings are happening outside with appropriate physical distancing, and reducing the number of visitors into the school. So there's some of the key measures outlined in that document.
And we've heard all that before, but it's always good to keep the reminder going. So let's talk about vaccinations. So during the lockdown, the Education Directorate did a survey about the rates of vaccinations amongst our school staff. And we saw that there were around 97 to 98% who said that they were either fully vaccinated, had their first dose, or were booked in. So tell us about the decision that the Chief Health Officer made to require mandatory vaccinations for some school staff.
So yeah, that's great news about the staff survey, and we anticipate that the school community is going to reflect the broader population in terms of vaccination coverage and high vaccination coverage that we're seeing across Canberra. But after much deliberation, the Chief Health Officer decided that because in primary schools, those kids that are under 12 years of age currently have no option to get vaccinated, and because we understand that there is quite a lot of community concern and parental concern about that, and that we take all appropriate steps to protect those young people, that's why that decision was made to mandate vaccination at this point in time for staff who are looking after those primary school kids, those early learning education and care centre kids. Also for our specialist schools where some of our more vulnerable children are attending, and our flexible learning programs. So while we know that the risk of children getting symptomatic infection and certainly getting severe infection is low, they don't have that option of getting the vaccine at this point in time. We hope they will in the future, and we hope that mandate will not be necessary in the future. But at this point of time, in line with other jurisdictions, that's how the decision came to be made.
So Vanessa, a lot of parents are interested to find out when under 12s can be vaccinated.
Yeah.
Have you got any advice on that?
I can understand that interest. I have a 6-year-old child myself, so I'm very interested too. So they're not currently eligible for a COVID vaccine in Australia. In fact, no child yet at the moment is eligible. But we know that international trials are underway. We know that other countries are looking really closely at this issue. I do understand that the Federal Drugs Administration Authority in the US is considering this later this month under emergency provision, so everyone's looking very closely at that decision. We do expect access to COVID-19 vaccines for children under 12 in the medium-term future, and that will be fantastic when that arrives, and we'll look forward as a government to rolling that out. But at this point in time, that's just not available to us.
So if I can just go back to schools, a number of questions have been asked about who can actually visit schools. What's your advice?
So our health guidelines advise that really only essential visitors visit school. So those sorts of people are exam supervisors, for example, tradespeople who have to do some urgent maintenance work, food and drink services for those canteens that are operating, and allied health professionals and legal services. And when those visitors attend, they always need to check in, like we've learnt so well to check in into the Check in Canberra app everywhere across the city. They need to continue to do the right COVID-safe behaviours, so the physical distancing, the mask wearing because they're adults entering the school grounds. Masks can be temporarily taken off if required, say for example a speech therapy session where it's really not practicable to have a mask on, but when that's done we recommend physical distancing and the mask going straight back on when the session's over. And it's really important that those people are there just for the service they need to deliver, and then they leave the school grounds.
You also mentioned canteens. So how will they be able to operate, or will they be able to open?
Yeah, look, the health guidance is that canteens can open with COVID-safe behaviours. So that includes pre-ordering and a click and collect system in high schools and colleges, and with the classrooms in primary schools, contactless delivery. So we really want to minimise large groups of students in canteen queues that are all mingling and gathering together in close proximity to one another.
And what about school drop-offs? Because I mean, my children are a bit older now, so I don't need to go off up to the front door, but can parents and carers enter school grounds to drop off their children?
No, we really don't want in the main parents and carers to enter the school grounds just for routine drop-off. Now, this doesn't apply to parents or carers that actually need to check in their child to early learning centres or out-of-school care, check in and check out. That can still occur. But in terms of just the routine everyday drop-off, it's sort of it's got a school gate and then letting them go in. Certainly parents can enter if there is an absolute necessity or an emergency, so we classify that say if a child hurt themselves at school or got sick and needed to come and be picked up, that's obviously one reason while a parent could come onto grounds, or if they needed to take their child to a routine GP appointment. And we just need to make those arrangements with the school ahead of time.
So you talked about visitors in schools and whether or not they're allowed to come onto the school site. How about private music teachers, private sports coaches, or some of those other activities like plays, those kind of providers? Are they allowed on the school site?
Look, we've decided that at this time, as we take this kind of precautionary step out of lockdown, that we will be discouraging, not allowing those people to enter the school grounds. It's really safest at this stage to limit visits to essential visits, and these, as much as kids love them, we would consider at this stage non-essential. It may be that those providers are able to negotiate online arrangements for those kinds of activities. I certainly know that at our school where my child goes, we're doing Zoom community singing with the singing teacher, which is wonderful. The parents can get involved in as well. So we've learnt to be very agile in that space, and hopefully that addresses, you know, some of the losses from people not being able to go on site at this point.
So what about out of schools hours for groups that hire school facilities, maybe like taekwondo groups?
Again, at this stage, we're discouraging other community groups that might otherwise use school facilities in out of school hours from doing that at the moment. And again, that's really just to try and mitigate against non-essential visitors coming on site. That does come with the exception, though, of obviously out of school care providers, YWCA and the like, that come on site to provide that aftercare.
Another question here is, do individual schools have the discretion to allow visitors on site?
No, look, we're really recommending, and I know the ACT Education Directorate is, that all schools follow the guidelines, the public health measures that we have put in place to keep the schools as safe as we can at this point in time.
That's good. One of the parents that has contacted us has asked if COVID-19 restrictions apply to non-government schools as well as government schools.
Yeah, it's the same across all schools. We're really suggesting and we're highly recommending that all schools follow those guidelines. Early learning centres, childcare providers, including out of school hours care, really also have to follow the guidelines. We spend a lot of time thinking about how to keep our kids safe, and we need everyone doing the right thing.
Yeah. So back to the health guidelines around masks. Who needs to wear them and when?
Okay, so staff and visitors, they all need to wear masks on school grounds, so all the adults, and so do students in year 7 to 12. So there are some exceptions, and these apply really across the community as well as within school grounds. So obviously, you don't wear them when you're eating or drinking, but you pop them straight back on when you've finished. When you're communicating with someone who has a hearing difficulty, or when it's really important for them to be able to understand your speech, and even your kind of facial cues as well. So it's that some kids with disabilities will require that. When exercising vigorously, so while we're not allowing external providers to come on site to do sports events with kids, there are obviously still physical education classes that'll be running, so that's a time when you can take your mask off. When you're outside alone, it's probably pretty rare in a school setting, and in an emergency. So of course masks need to be put straight back on after these activities are over. And I talked about primary school. That's a little bit different. Older primary school kids from year 3 to 6, they can wear a mask. And it's really up to their parent, their carer, or the child's preference on whether they want to do that. Children from preschool to year 2, we're not recommending to wear a mask. And that's because it can be a safety risk for the little ones, the really little ones, but also we know they're not necessarily going to be compliant, and it's not much use wearing a mask when you're not wearing it properly, really. It can be more burdensome.
You also talked about indoor sports as well and vigorous activity. So can students who are doing indoor sports wear a mask, or should they wear a mask? And what about close contact sports that are played outside? Should they be wearing a mask as well?
Well, I guess the first point would be close contact and indoor sports should be avoided if at all possible at this time, because we know that that does provide increased risk for transmission of the virus if someone is unknowingly infectious. But when vigorous exercise is done outdoors, and it can be done with sort of appropriate physical distancing, if it's not close contact sport, then masks don't need to be worn at that time. They should be put on straight after the activity. But we recognise that when you're doing vigorous activity, it can feel very uncomfortable and potentially risky, particularly if you have asthma or an underlying respiratory condition, to wear a mask at that time.
So Vanessa, this has been something that people are really interested in learning about, is what happens if there is an outbreak of COVID-19 at a school?
Yeah, look, I understand that parents and the community and staff are really concerned about this, and we do expect to see cases in schools, as we expect to see cases across the community. Importantly, again, to reiterate that COVID-19 in children is far more likely to be asymptomatic, or someone to have really mild symptoms. That severe disease requiring hospitalisation is really rare. So I think that's the most important thing to remember, and that's the most reassuring thing, I think. And that we're taking all of these risk mitigation measures to try and prevent transmission if there is someone who is unknowingly infectious at school. But each school has their own plan for managing a suspected or a confirmed case of COVID-19. At the beginning of the outbreak, and indeed throughout, we've had a few more schools impacted. These schools and the Education Directorate are becoming very expert about how to manage this. We work really hand in glove in health with education on these cases, and schools know what to do and staff know what to do. So if we think there is someone with confirmed COVID-19 and they're at school, they'll be required to go to a suitable space like a sick bay to isolate, and their parent or carer will be called to pick them up and take them home. And then if there's any other symptomatic staff or visitors there at that point in time, they'll be advised to go home. And then really it's over to ACT Health working with the Education Directorate to make a risk assessment about who might be impacted by that case being at school. Now we're hoping with the measures to reduce mixing and mingling, the attention to checking in, those measures to try and cohort classes to different parts of the school and shared facilities. We're trying to avoid whole schools being impacted by a case of COVID-19. And the degree to which we do that will really depend on the preventative measures that we can take at these schools. But we'll continue to work with the Directorate and communicate rapidly with those parents about what's required. And we've done that time and again during this outbreak. We're also talking to our colleagues in New South Wales and Victoria about aligning our risk assessment matrix, as we respond to cases and outbreaks, and starting to think about, well, what does it mean for vaccinated staff and children as well? So all of those discussions are ongoing, and really when we get to the point of being able to communicate that, we definitely will to parents and the school community.
That's really good to know, because I know parents have been asking, if my child, as a parent, my child is at a COVID-19 exposure location at a school, how will I know?
So that's a very good question. So they're likely to know from a number of avenues. So firstly, they're likely to receive some sort of messaging, either in the form of an email, letter or text message from the school. And then they will also be directed to the website. They also might get a message on their Check-in Canberra app. So it's likely that they're going to be notified through a few mechanisms and be provided with the relevant advice about what to do next. But we've got very adept at communicating really quickly to parents, and if the situation requires it, also having school forums where we actually talk directly to parents as well and can answer those questions.
So Vanessa, can you step us through how you came up with these particular health guidelines to manage COVID-19. So how can we ensure that they are the right ones for Canberra schools?
Yeah. Well, I guess I want to reassure families and our school communities that our guidelines are based on the best available evidence that we have to date. So we've been managing with COVID-19 for, a year and 3/4. And over that time, a lot has changed and a lot has evolved. There's been a lot of research, a lot of learnings from overseas, but other outbreaks too in other jurisdictions. We were so lucky to be COVID-free for such a long time, but we always watched very carefully what was going on in Victoria last year and Sydney earlier in the year. And all of that information has gone into this advice. That advice is from the national body called the Australian Health Protection Principles Committee. And that is Australia's key decision-making committee for all health emergencies. And you might be aware that all of the state and territory chief health officers sit on that committee, as well as the Commonwealth Chief Medical Officer. So it's a very eminent committee, and they consider all of that advice and all of those learnings from around the country and indeed around the world. And they have been formulating advice for specific settings, whether that be aged care or quarantine facilities and hospitals, and indeed they've done that for schools. So there are numerous statements that they've put out with regards to the sort of safe operation of schools along the way, and the most recent statement was released in the last couple of weeks. And so we use that as a guide in the first instance, and then we use the evidence and the discussions that we have with our colleagues in other states and territories to make sure that our guidance is the best.
So what would you say to, and you've kind of said this in your response, but what would you say to a family who's still worried about sending their children back to school?
Yeah, look, I understand that there is some uncertainty and some concern. I really understand that, and I think it's not limited to families. I think it's across the community as we ease out of lockdown. But I guess the first thing to say is population vaccination coverage, and we know from the Education Directorate survey, is that our staff vaccination coverage is really high. And now, as I said, the Chief Health Officer has decided to mandate that vaccination for teachers in those school settings where the kids are too young to get vaccinated. So that's an additional protection. We know the uptake in the 12 to 15 age cohort is really high. If your child's in that age bracket and has been vaccinated, that's the best protection you can give them. We have these health guidance in place, and the Education Directorate has worked so closely with schools and non-government schools to make sure that that advice is understood and is being rolled out. So I think we are in the strongest position we can be, and I think we have to consider the other option, and that's keeping our kids at home, not socialising with their friends, not having the opportunity to be in that face-to-face learning environment where really we know that's where the best education is delivered. We know the mental health and wellbeing impacts on kids from being in lockdown is high. It's a huge toll. So we have to balance that, and as parents and as government and as community, we have to balance all of that. So I'd reassure parents it is safe, but I understand that, and that's what some of this Q&A is going towards, trying to reassure and answer those questions.
That's right, and we've been doing everything we possibly can, following those health directions in our school communities, but also more broadly to keep those people in our community who can't get vaccinated yet safe.
Yeah.
So I think that's the main message, is to, if you can, get vaccinated, then you should.
Absolutely.
Okay.
So,
now you're asking me questions now.
I think it's my turn to ask you some questions, Minister. So the guidelines will see changes to day-to-day school operations to ensure that groups of students are physically separated. So can you step us through what that looks like in practice for ACT schools?
I can, thanks Vanessa. And you touched a little bit on this about what it will like and what it will look like, and it'll be a bit different across different school communities. But the main difference will be about limiting contact between students and between teachers and others. So we want to make sure that we limit that exposure from person to person. So that might mean that in primary school there'll be different age groups that will be in activities with each other, or that those groups will have different recess and lunch breaks, as well as making sure that they're using different areas around the school and sticking to those areas so that they can be easily traced should there be the unfortunate circumstance that there is a COVID-19 case in the school. Making sure that there's separate entry points for different age groups, the same with teachers as well, making sure that teachers use different staff areas and have staggered breaks as well for their recesses and lunch. And that's all about making sure that we limit that contact with each people based on the health advice that we've been getting, and our schools are coming up with those plans right now.
So Minister, there are a lot of questions too about students who are medically vulnerable, or students who might have an immunocompromised parent or carer at home. What arrangements are being made for them?
So this is really important, and we really need to make sure and reassure those families that support is there for them if they need it. So for students in Year 3 and above, they will be given access to devices like the Chromebooks so that they can continue accessing the Google classrooms, and students in preschool to Year 2 will receive that extra support from the Education Directorate, lessons in English and maths, as well as other learning areas for each individual day of the week. For the majority of students, however, we really want to try and encourage parents to get their children to school as soon as we possibly can. As you've talked about earlier, that sort of mental health and well-being and being amongst their peers is really important part of their class learning and social interactions. So we really do want to encourage as much as possible everybody who can come back to school to come back to school. We want to reassure everyone that it's as safe as it possibly can be, but it's really important for your young people to return to their class.
Yeah, absolutely, and that's their health advice as well. So quite a number of questions too coming from parents who are concerned about assessment in Term 4. So how is that going to work, Minister?
Well, it will work a little bit differently because things have been a little bit different to what we expected. So teachers will continue to assess students' learning, but they'll be taking into account obviously the circumstances that we've been through over the last 8 weeks. Students won't be assessed on things that they just haven't learned, you know. They'll be assessed on the things that they've learned during remote education. They'll also be assessed on the kinds of things that they've been doing at home while they've been doing remote learning. And teachers will be making judgments about these assessments that have occurred before we went into lockdown and students had to learn from home, and then coming back to school, and also what happened in between. So I think it's really important that if you're concerned as you're a parent, please get in touch with your teacher. They are there to help you and support you and your young person, and they will be there to provide you with the advice that you need around assessments.
That's great. So a question to you on ventilation, and I'll note here that my office has advised to increase ventilation. It helps to minimise airborne transmission of COVID-19. We talked about the simple things, but also how are schools increasing ventilation in their classrooms?
Yes, again, this has been a question that has been asked a lot. So here's some good numbers. There are 3,500 learning spaces in our schools, and every single one of them has been assessed for fresh air circulation. So the assessments that have been happened will form a guide about what we need to do next to ensure that there's that good fresh air flow throughout all of those teaching and learning spaces. Every single school will have an indoor quality air plan that will be provided and available before students return to school. We've already done that for our colleges when students returning to do their AST exams. And there'll also be adjustments to all of the school heating and ventilation systems to make sure that that airflow can continue, as we talked about earlier, around cooler or hotter days where that needs to happen. Also working across our school communities, our maintenance people and building service officers have been working around opening and unsealing windows so that we can have more of that fresh air flow coming in from outside through those more natural sort of mechanical opening and closings. And wherever possible, of course, we're going to start taking children outside more to have that fresh air and education outside, which I'm sure everybody will actually enjoy.
A number of questions have come in about travelling between schools. First, can my end of year inter-school volleyball competition take place?
I'm afraid not, Vanessa. Inter-school activities will not be able to go ahead for term 4.
Okay. What about students in Year 6 who would normally visit their new high school in preparation for the new year?
Again, unfortunately, these won't be able to go ahead either. A number of schools will be organising virtual visits to those schools, and that's what took place last year as well and worked pretty well, I think. So that's what Year 6 students will be able to do. But yeah, unfortunately, no sort of on-site visits at this stage.
Are excursions going to resume?
Excursions are really essential to a child's study, so we understand that these are really important and they can go ahead as long as they go in line with the public health directions. These excursions, of course, will require a COVID safety plan and they'll need approval from the Education Directorate. Again, schools don't have the discretion just to make these decisions. So unfortunately, only excursions that are essential to a student's study will be going ahead. So we just need to put a pause on those and on hold for the rest of term 4. But I hope today has been really helpful for everybody. We have received a lot of questions and I know that we wouldn't have answered all of them today, but I want to give a very special thank you to Vanessa, Dr. Vanessa Johnston, our Deputy Chief Health Officer, for coming along and spending all this time with us today. And if you have other questions or didn't get the ones that you wanted answered here, you can go on to the Education ACT website, who have frequently asked questions documents there for you to access, as well as the Health ACT website or the COVID-19 website. Heaps of information there for you. But in the meantime, thanks for spending some time with us today. Thanks, Vanessa.
Thank you.